All right, so I will call to order the Board of Health meeting of Monday, February 7th of 2022 at 6 p.m. So on our agenda this evening, first item is our minutes for approval from our last meeting, which was January 3rd of 2022. So did you guys have an opportunity to review the minutes?
Yes.
Yep, I saw these.
Yeah, they were nice and succinct, so great job, Shane, thank you. Kudos. I think this was your first official set of minutes, right? Second. That's right, nope, perfect. All right, so I will entertain a motion to approve the minutes as written for January 3rd, 2022.
Make the motion as stated.
I second it.
Okay, any discussion?
No.
Nope, then I'll call for the vote.
Yes?
Yes.
Yes, minutes approved. All right, next on the agenda, we have two local upgrade approvals. First one is for 163 Old Webster Road. This is a reduction to the distance to the well from the SAS and is it a 6-inch reduction or a 6-foot reduction?
That is actually 2 foot.
2-foot reduction, okay,
yes.
so it's just on here wrong, okay.
Yes.
We'll take a look at the
Written
plan.
down, okay, wrong.
All right, and this is Elizabeth Dupree, engineer? Okay.
Well, this is an existing septic system and house. The existing system currently is in the backyard. There's wetlands out back.
Okay.
The septic system that exists now, it's kind of a low level area in the backyard. Front is much higher. By putting the system in the front, they're able to have a gravity system, and with the reduction, 2-foot reduction, and they're using an Elgin system, so they're allowed to do that. But by doing that, they won't have to have a mounted system. If it went out back, they probably would have about a 6-foot mound.
Yeah.
It would be
Okay.
a great expense and to put it out back. Plus, it'd be in the buffer zone. So they were limited to that, but by doing that, they need those local upgrades.
All right, and then it's 56 feet from existing well.
Yes, 16 feet to the leach system to the house, the
There's a
foundation.
1-foot vertical reduction.
That's from the bottom of the SAS to high
It's actually
groundwater.
2 foot.
So this is so this needs to be updated?
Yes,
Okay,
Yeah.
all right.
yeah, it's a 2 foot, and Elgin is allowed under remedial use for a 2-foot separation.
Okay, all right. So the first one, so it's really gonna be an SAS with a 2-foot vertical reduction?
Yes.
Okay.
This needs to be updated too.
Oh, it's
The
not
app-
on the,
No, it says a 1/2 foot
oh, okay,
for the SAS, and
to
then,
high groundwater.
and then this says,
That's
Reduction
16
in-
feet
is that right?
from, that one's right, foundation to SAS?
mhm.
And then is the, from
Oh,
existing well on there
in-
too?
install, which is the SAS from foundation, yep.
Okay.
So there's three upgrade approvals.
Oh,
Yeah.
no.
Install the SAS 56 inches, 56 feet from existing well.
Yeah, let me just make sure. Because what's on this application is different than what's on here.
Plan. What did, don't recall what's on the application.
So, yeah, you wanna just read that one, that's the,
So the reduction and separation between the SAS and high groundwater, the separation reduction says 1/2 foot.
Yes, that's incorrect.
okay,
It's actually 2 feet. I looked at the grades, the elevations, and they are asking for a 2-foot separation.
okay. And then the other upgrade that's on here is the SAS from foundation to 16 feet.
Yes.
But I don't see the well on here,
Oh, wait, it's on the next page.
on the application, do you see it?
No?
Maybe on different,
No.
under setbacks? Should be there. If it's not, it's, has to be amended.
Yeah.
Conventional field.
So, no,
It's not here.
nope, it's not there.
It's the end though. This is relocation of the
Yes, it
well, but
is.
it's not.
It should be listed with the same section as the separate 16 foot to the house.
It's not.
And the well, they should be in the same section on.
So we'll just need to make sure that when we do this, it'll be contingent upon
Yes.
making sure that the plans
They have to upgrade
match
the
the
plan, and they
application.
have to upgrade the application so that they're correct.
Yes.
Okay,
Well,
all right.
I don't know that we can take action on it if they're not right.
I think we can. We
Yeah.
just, they're within our right to do it. We just have to make sure that the vote is contingent upon those changes being made, because otherwise we've got to hold it up till next month, so,
Okay.
and I don't want to do that.
What do we have in front of us that says it's 2 feet?
The verbal from Steve, I guess.
Yep.
I'm stating that it is 2 feet.
Yep. Okay. There's 56 there. And it's required 100, right, from well?
Right.
Yeah. And then 16 feet from foundation.
So it's the two, it's the well and the SAS to the foundation?
And
The
high
two.
groundwater. With a 2-foot vertical reduction. Okay. A poly barrier. Does this have to go to conservation because it's,
It
or is
does
it?
not.
Because it's far
Because
enough away from the wetlands? Okay,
Correct. Because it's in the front, it does not.
okay.
And then usually when it's closer to the well, we recommend, but don't require the baseline water testing.
Right, yeah.
Discuss that.
Do you know if they're getting baseline water testing? We can recommend it.
What the charge is to have it
No,
done, or?
do you know if they're doing it just because it's within,
I
it's
don't
less
know.
than
It's
the
their
100
own
feet?
well. I know it's,
new
we
system.
do it for a budding well.
Yeah.
We have it done. But the well on their own property.
okay.
It's a new system.
And it's a new system, so, right?
Yes, it's a new system.
Existing system. Would show some.
Quite certain the existing system is in the groundwater, out back where it is located.
Okay.
Oh, the old system's.
So it'll be a
okay.
much better situation out there.
Is the old system, do you know the old system, how close it was to the well?
It's shown in the back, there's a honeycomb.
Is that where it was?
Yes,
Oh, so it was beyond the 100 feet there.
yes.
Well, I mean, it's not gonna hurt us to at least recommend it if they want it. Just because they did have that, because that system is in failure, right?
It is.
So, just to make sure that, we can recommend it, not require it. There's nothing that says they have to do it, but
Okay.
if they want to, they can, just in case they have problems down the road.
Mhm.
We can say that we recommended it, you either took it or didn't, right? So,
Yes.
it probably wouldn't hurt to at least recommend it. Okay, good. Any other questions?
No.
Okay. Alright. Alright, so. Do you wanna do all the local upgrades together as one, or do you wanna do them each individually?
Can we approve the first one? Is one of them right?
They're all, well,
They're both
everything has
different.
to be changed based on the application.
Okay, but I just wanna-
And on the.
I just want to be
correct.
clear, sorry.
So,
Well,
yeah, you know, I
but
think
this,
it makes,
this is correct, right?
it makes it very difficult for us to take action on the documents
that's
that have been
wrong.
presented when they're not correct.
But Steve,
And
correct,
they haven't
correct me if
taken
I'm
the time.
wrong, that it was a 10-minute per inch perk in the field,
Yes,
and it's an Elgin.
it's an
correct?
Elgin.
So it does, that variance, that's not a local upgrade approval requirement for the separation to groundwater if it's gonna be 2 feet, correct? Because the Elgin allows that.
It's allowed under a remedial reduction under the local upgrade approval.
So,
So instead of a 1 foot reduction, they can get a 2 foot reduction.
Right, because normally Elgin, so like your infiltrators, your pipe and stone, you have to have 4 or 5 feet depending on the perk. And with the Elgin Presby, you can have that separation.
Yeah.
It's allowed by
I
DEP.
don't have an issue with the system, I just have an issue with people putting in paperwork.
That
they
doesn't
haven't spent the
match.
time
That
on
doesn't
to make it
match, yeah.
correctly. I mean, if they care about it, why not take the time and make sure it's correct?
alright.
So, you know, We're taking Steve's word for it, and we
Yes.
like Steve.
Unless, I mean,
We
they
know
have written down
Steve.
here, unless
But,
there's
I mean-
this information here on the schedule of elevations that they have, unless that's incorrect. I'm looking at that, for the elevation for the groundwater, which I believe is correct, what they
Okay.
have there. And they're showing that 2 feet over the
Okay.
groundwater.
Is that on our print?
That's on the
or is-
plan, yes.
So then maybe just this part is wrong, where the request for the
I
local
think,
upgrade
I
is.
think just the request is
Okay,
incorrect.
so this part's wrong in terms of that, but the calculations and everything that you're
Design
seeing
calculations
here.
and elevations
Okay.
are correct.
So basically, as long as, because that makes more sense to you, so if you've looked at that
Yes.
and we're good with it, then I think as long as we get the plans updated to make sure it all reflects the same, the plans and the application, to make sure that they match.
Final plan that gets
We'll be
filed
fine.
has to have the correct
Yes.
information on it, and
Okay.
the application. They both need to be upgraded.
Okay. All right, so I will entertain,
Sorry, before you.
It's okay.
So there's 3
Yep.
issues, so it's the foundation to the
Yep.
SAS,
foundation SAS,
the high groundwater,
yep,
and then the well
SAS to
to the
well.
SAS,
Mhm.
okay.
Okay, so I will entertain a motion to approve 3 local upgrade approvals for 163 Old Webster Road, with plans drawn by Clearwater Environmental, dated, what do we got for November?
18?
Yeah, November 18th of 2021. The local upgrade approvals are as follows. For the reduction from the SAS to seasonal high groundwater, to, from required, how many feet was it? 4 feet?
4 feet is the, yes.
Okay, from the
required.
required 4 feet, down to 2 feet.
Yes.
The second being the install from the SAS to the existing well from the required 100 feet down to 56 feet, and a reduction in the SAS to the foundation from the required 20 feet down to 16 feet. And that will be contingent upon the plans to reflect the local upgrades as we just outlined them on the plans, and for them to match the application themselves.
Make the motion as stated.
I second it.
Any discussion?
No.
No.
Nope. With there being none, I'll call for the vote.
Yes.
Yes.
Yes. Approved. Back to you. All right, the second local upgrade approval is for 45 Merriam District. This is a reduction in the depth to groundwater by 4 feet. Is that correct? Nope, that's not right. I'm reading this and I shouldn't
Yes.
be. I'm just gonna open this and then I'll read it. How's that?
Well, you won't find it on there because it's not marked on the plan. Like it's supposed to
It's on the plan, the
Is it?
local upgrade request.
be. Where?
It's directly under the plan view. It says the system requires the following local upgrade approvals up to Title V and/or local regulations.
You know, sometimes it takes a little bit
This
to
is
It's about a
find them.
third of the way from the left in, about 6 inches up from the bottom of the plan.
Notes? No.
Is it in these pump notes? I read pump notes, I didn't see
There's
that.
none there, none there.
Proposed poly barrier.
Yep, they're not on here.
Oh,
Are
it's
they
like
on
the-
yours?
The
See, I
plan
think
that
you're
was
getting better.
emailed.
So why
You're getting
are-
better stuff than we're getting.
So why are the plans not matching?
That was a good question.
That's funny.
That's why I'm wondering now if the plans we just looked at for 163, are those the same as the ones that you have?
Yes.
Are we looking at an older
Yeah, we
version?
were looking at the same. We were talking
Okay.
about,
Is that a revised
agreement.
plan?
This one is,
When you get them, are there 2 copies and you're just splitting them?
received November 29th.
I'll show you this
Yeah, it'd be great if you can.
copy here. from
Yeah,
here.
it's right
Okay.
there, okay.
Well, that's funny.
Yeah,
I
so that
scoured this
doesn't.
plan.
But it looks like it,
Okay, so
It
here's
was
the,
revised,
it's
right?
dated different. So this one here that
Okay.
we have is stamped 11/16. This is stamped 12/22.
Okay.
So we actually shouldn't even be looking at this plan here.
yeah, that's, I was gonna say, the one that was emailed out
Can you
is
check the
has
last
the
plan also?
revision.
Was
See if
this
you-
one?
Yours is
Yeah,
different from
okay,
the one
yeah.
that we have?
Well, the last one, when we were talking about the last one, we
Yeah.
were talking, it was in agreement. The things we're talking about was the same, my plan.
I don't know, the one
Okay.
that you
Showed the
emailed out.
same.
and
Yeah,
the-
so these were
to the-
dated, these were dated different. So this is the most recent
Recent.
version. Yeah. It's like a month off. Okay. Well, that solves the problem of
Yeah.
us not having it on there.
Clouds part and the light shines down.
That's right, okay. So Miriam District, it's going in the front of the house here?
It is. And what they're asking for there, it's a repair again, and it's an Elgin system also.
Okay.
So they're asking for the 2-foot separation to groundwater.
Okay, from the required 4.
Yes, they're still gonna have a mound there, it's in the front yard, but instead of having a 4-foot mound, they're gonna have a 2-foot mound.
Okay,
It's gonna blend in much better in the front.
yeah, I'm
It won't
sure.
be quite an eyesore by doing that,
And it meets all the setbacks.
yes. Everything else it meets, it's
Yeah,
just
it's got a lot of,
the space is groundwater separation. For aesthetic purposes, cost and aesthetics.
and this is a repair, right,
It
of an
is.
existing system?
Right.
It's a
Does
lot
the
of,
application say the same thing?
Yeah,
yeah,
2
application.
feet.
It's a lot of land in the back. That's why I
This
was
is
kind of
already a-
surprised to see it in the
This is an
front.
existing mound.
Oh, okay,
So they've already built this mound for it.
yeah.
So this is new.
No,
So
I just
they
was
built it-
shocked that it wasn't in the
this
back
is-
of the
This
house.
says it's a new system. It's a new leach field.
New leach
Existing,
They're-
existing septic tank, but
Existing 15.
Yeah.
the leach field they're saying is new.
The leach system is correct. It's an existing house.
Okay,
I mean, the
They're
plot
they're
doesn't
replacing
show
the
any
existing.
grade. So it looks like they'd have the same mound wherever they put it, right?
Correct, there's a mound already there. It's not, it's gonna be built up a little bit more.
Okay.
It's not, it'd be a bigger mound anywhere else.
Yeah.
But it seems like it would have, because it's a flat plot, looks like it'd have the same groundwater issue wherever it was on
And for the
the.
most part, yes. I don't think the groundwater's gonna fluctuate much in that property. But the well's in the backyard.
yeah, I see that there, it's got plenty, and then this well here. Is there
Yes.
another abutter over here?
There is, but that's quite a ways off.
Ways, okay, so no
Yeah.
issues there. Okay,
Really,
okay.
when this was taken.
All right, anything on there?
No, this all looks good.
Okay.
It says 2 feet?
Oh, no.
All right, so I will entertain a motion to approve, local upgrade approval for,
Are we still stamping it with the date that we receive it? That's what I usually go by.
Yes, we do.
That should clearly indicate what the latest print was.
The one that was emailed out is the correct one, so I'll have to look to see if they submitted a second hard copy to us.
Okay.
Cause like we have, like the email that went out to the board with the plan has the correct,
Okay.
okay,
has that on it.
all right. All right, so I'm gonna start over here. So, I will entertain a motion to approve a local upgrade approval for 45 Merriam District, with plans drawn up by Green Hill Engineering, stamped and dated 12/22 of 2021 for a reduction in the, SAS, to seasonal high groundwater from the required 4 feet down to 2 feet.
Make the motion as stated.
I second it.
Any other discussion?
No.
No.
Nope, with there being none, I'll call for the vote.
Yes.
Yes.
Yes. Approved. Do you want this one back?
Yeah. As long as we do have other
Yep, so
plans.
yeah, they've got it
I'm
there.
gonna, I'll double check.
That's fine. Okay.
I got the other part.
Oh, yeah. Thank you, thank you. Alrighty. That's it for our local upgrade approvals. Thank you so much, Steve.
Yeah, thanks, Steve.
All right, so now we have director's report.
Yes, So, just a few things. I know you've been getting my weekly emails. I hope that they're helpful. So we did have a COVID vaccine clinic last week. Unfortunately, the numbers weren't as high as we'd anticipated, but we still got 10 people their boosters. Honestly, great experience. The state partnered with Purple Shield. They came. They had everything. They set up. They had their groove. They registered people who weren't hadn't pre-registered. They came with all the vaccine types. So I was really happy with them. Unfortunately, we didn't get as many people as I had hoped. So I think for the time being, unless the board thinks otherwise, we might not necessarily need to host another one or do another mobile one. Maybe in the spring or summer we can reevaluate, especially if there is talks of more boosters needed. Who knows? It's constantly changing. We have been
Maybe a little bit prior to the next major holiday.
Yes, that's true. That's true. Might get more people. We've been continuing distributing the test kits that we have. We had an event on Saturday. Again, not as many people showed as we had anticipated, and we're going to be getting additional test kits hopefully tomorrow or Wednesday, another 800. So we'll be continuing to distribute those. I'm thinking about potentially having like a weekly or bi-weekly distribution event on like Wednesday evenings or something where our residents can come in that need one.
Are there any restrictions to who can get them?
Not anymore. No, we were restricting it to if you've already come to get test kits from us, we ask that you wait. At this point, I would say if you're in need of one, give our office a call, and we can hand those out.
Okay.
And I know police and fire, we're looking some of the additional test kits that we're getting to maybe give some to those, give some to the senior center to give to their residents, maybe have another distribution event at the Oxford Housing Authority, because we did have a good turnout there. Those residents do seem to want the test kits. We still have the Buy Next Now test kits for town employees that are symptomatic or close contacts. Luckily, the use of those has gone down, so hopefully that will continue, but we still have some of those. Before I turn it over to our contact tracing nurses, I also want to, in my email, I think it was on Friday, I submitted the Maven Report of all the reportable diseases that have come in for the month, so I'll continue to do that, just so you have an idea of what other ones we're seeing other than COVID. As you can see, COVID is still the number one. The others are pretty small, and flu is pretty low, which is a good thing, or it's going unreported. That could also be.
I just had a question about, so have you had any feedback on why you think the distribution of the kits wasn't as high? I mean, like location-wise, I'm trying to think if there was.
So we were gonna have it last Saturday, but then we had the snowstorm.
Yeah.
And this Saturday, again, weather wasn't the greatest. It was pretty icy. So I'm wondering if weather has something to do with it.
Okay.
I also feel like it's been easier to get test kits now than it was around the holidays.
True.
And numbers are starting to go down.
Yeah.
So I'm hoping that by opening it back up to, even if you've gotten test kits before, if you need one, we'll distribute it. That hopefully that increases it. But other than that, I haven't heard. We haven't posted it in the newspaper, so I don't know if that's a way to get it out to more people. It's been on the sign in front of Town Hall, our Facebook page. We're getting our followers up, so that's exciting.
That's
so
good.
spread the word.
How many followers do we have now? I haven't looked recently.
I want to say close to 80.
Oh, good.
Yeah. So we're getting there. I know the Town of Oxford Facebook page also posted about the test kit distribution. So did the senior center. Laura's been a great partner with us, helping us with the distribution. But why? I don't know. I was hoping that like we would have a large turnout on Saturday, but it wasn't as many as I anticipated. So.
Did this would the schools be someplace to have some kits available to hand out?
We can tell you all about it now.
Yeah. Okay, we'll look forward to that in a moment. Okay. I'm just trying to think of other ways to just make sure that we can get them out there. I hate to have kits that could go to waste, you know?
Right.
So.
We're still good on the expiration dates.
Okay.
We still have some time there. I wouldn't let them go to waste.
Yeah.
So, like I said, I'm thinking we're here late Wednesday nights. maybe having it, you can come by, as long as, if we start getting crowds, maybe we'll have an actual like event where
Yeah.
we'll set out a time, a designated spot, so we don't get overwhelmed, but,
I'm even thinking prior to February school vacation week.
it'd be a good one.
Mhm.
Yeah.
It's a good idea.
Yeah, I don't know where people are gonna go.
And after too.
Yeah.
Because there'll definitely
Yeah.
be need.
Okay.
And then the other thing I wanted to bring up is we received a call at the end of last week, I think it was, about microblading. So there is that interest in town. I know that the board likes to meet applicants, so is this something I should invite her in for the next board meeting? And then to potentially look at our body art regulations and look to updating them to include microblading. It's starting to come.
I thought it,
We have it in there.
I thought it was in there. I could be wrong,
No, we
only
talked
because we
about
did
it.
have somebody
We had
come
one,
through
yeah.
and
Yeah.
we did a bunch of research on it
Okay.
ourselves.
Because I
And then
know.
I don't think she ever ended up doing it.
I know the one thing that I didn't notice in there that I would like to see in there, based on other town regulations, is requiring an apprenticeship.
Oh, okay.
And we had a great training in October about microblading, and I just want to make sure that whoever's coming to town has been properly trained.
Okay.
And I feel like, and that includes like apprenticeships for any body art. I think that would be a good thing to include in our regulations. I know Boston has that, Northborough has that in their regulations. So to include that, because cosmetic body art is coming. I know the woman that's interested in microblading, she also wants to move to lips at some point.
Yeah.
So it's just something to.
That's the new thing now.
Yeah, it is, yeah.
Newfangled thing coming up, yeah. Okay. Yeah, we'll have to just review these just to see. But I had thought that we had,
Included it.
I thought that, I don't know if we were included or if we reviewed it and said it still falls underneath the definition
Of
of
body.
tattoo
Yep.
and body art, which
Yep.
was why they had to get both. If I remember correctly,
We talked about it, so.
we had a big discussion.
And in most communities, it is considered part of body art regs, but I just like to have it specifically like the cosmetic tattooing included in there and maybe looking at the apprenticeship
Okay.
piece. So that's something I'm willing to like present potentially at the March or April
Okay.
board meeting. But we did have someone call that was interested.
So
Okay.
the apprenticeship varies town to town, it's not based on the licensure?
No, so body art is licensed on the local level.
So it's
Um,
town to town.
Exactly.
Okay.
Yep. And so the apprenticeship, some communities will say a year, and that is working under somebody else's license, and can be in another community having that experience learning from a licensed artist.
Okay.
Okay.
So those are my main updates. Any other questions for me? Yes.
Community partnership, have they been able to hire an inspector or?
Oh, yes. Thank you for bringing that up. So we have the community health worker. She's still on board, Lori. The inspector, it was divided into 2 part-time positions. We have offered we have offered the job part-time to a food and housing inspector. So I think he's going to be starting mid-February, and we're still looking for septic. So we've gotten some applicants in. Don't necessarily have experience, but we're potentially going to be looking to interview. And if we feel like someone fits and maybe has a little bit of background, we would bring them on and train them. We have also, then with the other grant, we have extended an offer to a full-time epidemiologist. I don't know, I think they're in the process of the paperwork, so I'm not sure exactly when she'll start. And then a public health nurse, we've offered a position, and same thing, I think they're in the process of doing background checks and then doing the paperwork, so hopefully starting sometime soon. So that she'll be working closely with our contact tracing nurses, and hopefully taking some of the load off them as well.
Okay.
So that's where we stand.
Great, thank you.
Yeah.
Great.
So then I'll turn it over to our wonderful contact tracing nurses who have done an amazing job, continue to do an amazing job.
I do like the way that the graphs are trending.
Oh,
Yeah.
Me too. It's not quite, although, as, no bad news, Kathy.
No, no, no,
No, I'm so
I know.
excited.
She's so excited. I know, I love that.
I like numbers that aren't in the triple digits in a week. So,
Yeah.
I mean, January by far was the largest amount of cases we had throughout the pandemic. Of people who actually tested, of 910 was what we ended up with. And prior to that, we thought December was bad at like 427. So,
I know.
so it was it wasn't double, but it was getting there.
It was getting there.
But it's kind of funny if you look at the way the numbers are mirroring each other, like the way they went up, they're kind of coming down. So
Right.
I'm looking for the teens soon.
Yeah.
So, so that's, I mean, it's definitely, and it's a trend we're seeing in the schools too, which is really exciting.
Even in the
so.
hospital too.
Yeah.
It's the
I
trend
think it's
too.
everywhere.
Yeah.
The state. So it's definitely nice to see. The numbers, as far as the trend in town, it still continues to be the same through households. Maven has where we can kind of look and see 18 and under. What they don't have is I'm looking for 85 and older or something.
Yeah, that's why I tease it out when I do that.
Yeah, but because those are the people that we're trying to reach out to, to check in on. We check in on the kids, especially the students at our schools, but also, if we see an infant or things like that, we're reaching out to them as well.
And that one was like only 10 in 3 days. It's like, oh, it's easy to figure out
Yeah,
who's what
yeah.
age.
Easier. Yeah.
It is nice that they break it down, because initially Maven never gave us the breakdown, which is so nice that they do, at least above 18 and under 18. They do under 5 too, because of the whole vaccine status, but that's going to, that'll change too, so. But it's nice to be able to have it, to at least at a glance, be able to say, okay, this is what we're seeing or who we're seeing, so. That has been a big help that they did that, especially, and they did that as they started to move away with doing every case, saying older and younger cases, and that's where they want to concentrate to, with the older people, you want to make sure that they don't have any questions or any needs, and then with the youngers, you want to make sure they're not spreading it either in daycares, preschools, or schools. That was also, in this whole month of January, a big thing was because not only did the schools change protocols, with DESE, but also EEC. So a lot of time was spent going over regulations with preschools and daycares, and, because I feel like some of them felt like they just got it understood, and now,
Changing
Yeah.
it.
and they're like, I don't know if I want to change this, what'll this do, especially for those who had daycares at their homes. And then, of course, they have parents calling them saying, why isn't my kid back yet? So it was, it was a balancing act. So that was a lot of our work in the past couple of weeks, has been
Even
with
this
the
weekend
change.
was, I talked to a couple of daycares, and what the EEC is doing is just basically saying, they'll talk to your local Board of Health. And, so they're not getting a lot of guidance, and the guidance that we're giving is changing, and now they're doing the test and stay in their daycare. So they have all these tests, and I wasn't really, I hadn't had anyone do that yet. It's just been, the quarantine.
Right.
And I did have a provider say, well, what should I do with all these tests? I said, what tests do you have? And it's like, well, the states, and I said, oh my gosh, yes, you can do that. Because, they're unvaccinated, because of their
Right.
age. You can test and stay them. So that's what they ended up doing. They're doing the test and stay for any, parent that consents, and those that don't, they have to do the outside quarantine.
And I think it depends also on the size of the daycare, whether they're doing it or
Right.
not. And some don't want to take it on. And also just going over with them that under the age of 2, home tests are not valid. So, and also the fact that even EEC was saying, you can get out on day 6 as long as you can wear masks. Well, if these kids aren't wearing masks, it was explaining what the difference was with an older child versus the younger child, and vaccinated, unvaccinated, with the usual questions.
Okay.
Because, family members can have one thing going on in the schools, another thing going on at daycare, so it's very confusing to them.
Yes.
And it changes every other week, so it's confusing for everyone, so.
Now, when, so let's say somebody goes to CVS or Walgreens or wherever to get tested. The only way that goes into Maven if it's a PCR test that goes to the lab.
No,
They
no.
can get a rapid.
So if
it
they
just
do
has
a
to be a
rapid-
proctored official test.
Okay.
But the kits, those don't go into Maven.
Okay, so,
Right.
because only reason why I'm asking is because my son had a rapid at CVS in Charlton, and it came back positive. But yet he never was contacted.
He won't though because of his age.
Okay.
We're no longer,
Oh, right.
you know
right,
what I
right.
mean?
So you're
it's
not
age
doing
dependent.
okay.
Right,
So
yeah.
what age are you
DPH,
doing?
it actually is 65 and older, they said on their last call.
So those are the only ones you're
and
calling?
School
Right.
age and younger.
They're really, like, contact tracing, they've said.
Yeah.
It's not worth the,
Yeah.
you know,
Oh, I didn't care. I'm trying
I
to
know.
understand it because
Yeah.
I was like waiting for him to get a phone call, you know?
And sometimes the rapids too, and we've always found this, that sometimes we'll get a rapid result. We'll call somebody and say, I noticed, I got a notification. They're like, yeah, 10 days ago I tested positive. And it just posts to Maven for some
Oh.
reason. I don't know why
Is it
the
slow going in?
rapids, they come back quick, but they don't post quickly. So,
except our school ones are doing great.
I know.
We had a positive today that posted today.
Yeah, as soon as we put it in, it posts.
Love that. I mean,
love
I
it.
know, but I've always been
It's very
curious.
satisfying.
No, I've always been curious as to what the, how long is the turnaround?
Right.
Yeah.
And it wasn't in my school, and I was looking tonight before I came in, I go, oh, that's a student. That
Yeah.
student was tested today, and it's
Wow.
already in here.
Yeah.
So
Nice.
that was really,
Okay.
and I think that has taken a little time. It definitely,
Right.
that has been ironed out, but it's nice to see that there's that turnaround.
Yeah. So the
So.
schools actually, we're changing, we're out of the test and stay.
Okay.
Department of Education has, kind of given the option of you can contact trace with a test and stay, or give home tests every 2 weeks and have the student test every 2 weeks.
Okay.
So it's on the honor system. They're not required to show the negative test result. But I think at that point, there were so many, we were going through so many tests, and yielding a very low positivity rate when compared to, so, one positive case, we'd have 10, up to, there could be 10 close contacts that we're testing every morning. And very, very low positivity rate for them. So I think Department of Education really took that data and said, you know what, it seems like we're spinning our wheels for a pretty low yield there, so.
And still, even when the schools, what we're seeing is siblings, you know what I mean? Like,
Right.
we had some that have been cleared, and then we did the test and stay on them, and they were popping because they had been in the same household, so it wasn't
Okay.
because they were sitting in class. I've had children literally desks next to each other, positive on either side, but the middle child did not become positive, so it wasn't making much sense to chase around to see where every child had been during the course of the day and who they might have spent 15 minutes,
Right.
But that's what it was for, right? That was
Yes.
like to figure out.
Oh, yeah,
What- you know,
I
what
mean, we needed to
was
get to this
working,
point to
yeah.
say,
Yes,
okay,
yeah. Right, we had to collect that data
Right.
because, did we needed to know, is this spreading like wildfire? And, and I think, Department of Education gets some slack from both sides, but I think they've done a good job with figuring out, okay, that's not working, let's try this, that's not working, let's try this. So it's not always convenient because it's more work for us usually to kind of pivot and now do something else, but I think this is going to be a good change, which might also affect people needing tests, because now they're going to have tests. Once a week, they'll be testing themselves, ideally.
And they need to get their own tests.
No, we
No, no,
give
we're
them.
giving
So
them.
you give them to
Yes,
them?
yeah.
Okay.
if they
Yeah.
sign up.
If they
If they
have
sign
to
up,
opt
okay.
in, but that's just, we have to kind of give a number every week, this is how many people have opted in. Desi sends us all these kits, we distribute them. So we'll see how that goes. This is starting this week.
But if the parents need a test kit because they don't have one for themselves, send them our way.
Yes, oh yeah,
Right, exactly.
absolutely. Yeah, oh, I will.
Well, I was
Because-
also thinking the upcoming winter festival where some things are going on in the community center, that would be a good
Yeah,
place to do it.
Right,
That's actually not a bad idea.
Yep, that's a great.
Just because I know there's gonna be
We'll set up a
activities.
table.
right.
No, but I'm thinking
Yes.
that would be a perfect place to
Yep.
give them
Yeah.
out, because hopefully I think it's exciting they're doing that, and hopefully that'll be
know.
another,
Are we giving them to the offices at like the Housing Authority and just giving them extra kits just to
We
have?
have not yet.
Okay,
Because
because that's something that just to hang on to, because they'll be getting the calls randomly, I can't find a test kit, or they're too expensive if they're going out
And with this additional 800 that we're getting, we have a little bit more flexibility, so my hope is to be able to distribute those a little bit more broadly.
Yeah.
Like, to give them to maybe to the housing authority or even police, fire.
Right.
Have a lot of contact.
Yep.
Community center.
Right. Yeah, so I think tests, that'll be good. Everybody will be able to get their hands on some tests.
Okay.
Whether they, you know, they're not always, 'cause sometimes you have that double test kit, you really have to use both of them. Because you'll have a symptomatic person that's testing negative.
Right.
2 days later, they're positive, you know, so.
Okay. All right. The other question, so just to so Desi, what is the new date for continuing with the mask mandate in school?
Oh, that's,
Is that pushed out
Around
to
after
March?
February vacation.
yeah, it's after
like-
February vacation. No, they haven't extended it.
Okay.
I have a feeling it's, you know, I could see because this new testing system process is until April 22nd.
Okay.
So I could see if numbers are down and, you know, it's spring, it's after April vacation, you know, I could see the masks going away. I shouldn't have even said that out loud because what kind of nurse am I? Yes, but I do, I'm just so hopeful.
I'm very optimistic.
Yes,
nurse.
yes, I'm
Yeah.
optimistic.
I don't know. So, okay. All right, any other questions?
No.
I like
Doing
the
a
way
great
the
job.
numbers are going. It's amazing to see where the numbers were, like, last year compared to this year, and yeah, it's a little crazy.
Mm-hmm.
All right. Anything that you need from us?
This is,
Uh,
no, I
No,
don't think
no.
so. No, I want, as long as the numbers keep going this way, I'm
Yes. I
perfectly
know.
happy.
yeah,
I
we're
know.
good.
I know. I hope so too.
Yeah.
So
We
it'll
just,
be-
you know, again, lots of calls from the youth leagues, basketball, what do we do? You know, but there, you know, I basically just said, we can't, you know, trace for a team that has several towns in it, you know, the Webster Oxford
Yeah.
Basketball League. And I can't necessarily just take, you know, the president's word for it, like, you know, this kid, none of them were exposed or someone would. So basically, you know, I just kind of put it in their hands in a way that you really need to follow what we're doing. And I just sent the data, the guidance that we're, you know, what we're doing, and just, you know, said you can, you know, the president knows who the school nurses are for each grade, I guess, you know, the 5th grade team, he'd call the school nurse, but we can't really give any information. We could just take it, you know, so. But yeah, and I imagine that's after basketball, then we'll be into baseball and it's outside, so.
Yeah.
Get that.
It'll be a little bit,
Yeah.
a little
Right.
bit safer, yeah.
Mhm.
Okay.
Thank you.
All right. Well, thank you very much again for
Yes.
everything you guys are doing, and strong work.
Yes, thank you.
Going in the right
We
direction.
love to
That's
say
all-
it's coming to an end, but we've been
I
saying that for
know.
2 years.
Yeah.
like-
But
I know.
these, I will take this. I
Yes.
used to
Yes,
think-
oh, I
when I used to
agree.
think 40 was a lot, I'm like, no, that's nothing.
No, that's nothing. That's absolutely nothing. But thanks again very much.
No problem.
All right. Next on the agenda, we have fee schedule.
Yes, so I was proposing some updates to the fee schedule, and you can see the chart, it's 2 pages. So I tried to give you an idea of what other communities are doing, and so why I'm recommending some of these. I think it's time to update it. So I can go through it, and then we have questions. But so for a new food establishment plan review, the plan review, it can be quite lengthy, so I feel like the fee should definitely go up. And as you can see, I've proposed 200, which is much more in line with what other communities are doing. However, I don't remember which community it was, but I did see that. So sometimes you'll have an establishment that's existing. They might be doing some minor renovations. Technically, that triggers a plan review, but it's not as extensive. So I was thinking of maybe having a lesser fee, or you're having a smaller business that's buying out, let's say, a pizza shop, and they're doing no changes. So the floor plan's staying the same equipment, right? So again, it doesn't require as extensive a review, so having that lower fee. So that's why I suggested those 2 fees, one for like a totally new business, or one that's doing like greater renovations, versus one that's maybe bringing in a couple new pieces of equipment, throwing some paint on the walls, you know, like smaller, or an establishment that's switching hands, but nothing's changing. And then again, retail food, I just thought comparatively to other communities, wanted to raise those a little bit. And same with based on seating, mobile as well. Caterer, I also had 2 fees.
Rika,
Yes.
can you just go back to the
Of course.
food establishment?
Yep.
For a new owner, a new establishment, they have to get a new permit.
Correct.
Don't they require a full review whether the equipment has been there under other ownership before?
Correct, but I find it to be, and so we can keep 1 fee all around. I find it to be a little bit less extensive, especially because we've been in there. So if it's an establishment that we know the equipment is commercial grade, right? We know that they've been holding properly. Then yes, they still need to submit all those documents for review. A lot of times they don't have the specification sheet, so I'll ask them, take a picture of your equipment to show me that it is commercial grade. But sometimes it does just take less review because we already know the business, we already know the establishment, we know the equipment, we know the floor plan. In all the communities I've been in, we've had a flat fee regardless. Sometimes I feel like it's not necessarily fair to those businesses that are doing minimal work or that are not making any changes, but most communities it is a flat fee. So I'm happy to keep it 1 flat fee as a plan review, but I also thought that was kind of a compromise. You could also raise that so it's a little bit more in the middle of the 200.
I can see the renovation, if it's an existing business and you're dealing with the same people and they have their equipment and that's on their previous plan. But I think under, you know, when you're talking about new ownership and a new business, it really is a new business completely.
Yep.
They need a full review.
Yeah, and to me the full review happens. It's just it doesn't tend to be as extensive. That's the only reason like I said, unless if they're bringing in a bunch of new equipment, right, and maybe changing the floor plan and how things are looking.
I may be a bit jaded because sometimes when somebody's buying an existing business or it's changing hands, they're a little light in their application work, saying, oh, it's just the same as it was.
But to me, personally, when I like to see, like, you need to get me something, you might not be able to get the exact specifications, but you need to show me something that your equipment is commercial grade. I still want to see a floor plan, and particularly for when there is a changeover, what I do like to do is, that's when you get your capital improvements, right? So you are right, sometimes those can be more expensive because I'm going to require things to be upgraded because now it's under new ownership, it's time.
Yeah, I think for a new business, we want a full,
Perfect.
then for renovations.
And then
yeah,
keep that
that's-
for renovation?
That's fine.
Okay,
yeah,
that works for me.
That's my opinion.
And then catering, it was something similar. So some businesses are catering only; they're only a caterer. So I would have charged them a $200 catering fee. I was looking to increase that. But some businesses, they're a food establishment, but they also cater. So if they're in addition to a food establishment, they're also catering, I was going to have a smaller fee. And part of that is their permit. If they are a caterer in addition to a food establishment, their permit should say they're a caterer. Because if they go to another community, they don't have to pull a permit with that other community, but they have to go to that Board of Health and show them that they have a permit, they have a catering permit from their base of operations. So it should technically have something. I highlighted nonprofit because I was just curious about the fee. In the past, in my communities I've worked in, we generally haven't charged nonprofits depending, like a lot of times the churches, we wouldn't charge a fee. I know you have a separate fee here for churches, so I didn't know if there's a history to that. I'm happy to keep it there.
I think our history is if they ask for a waiver, we waive it.
Okay,
Yeah.
But if they don't ask,
then, okay,
we have a fee.
perfect, good to
I think
know.
We've been pretty consistent in that.
And then the temporary, so I wanted to remove the temporary over 15 days because technically by the food code, a temporary food establishment is actually 14 days or less. So there can be so you could do a seasonal permit if you wanted one that's just here for the summer months, like an ice cream truck, or that's gonna be only open 2 months or something like that, you could always do that. But technically, if you label it temporary by the food code, it's only 14 days or less.
Okay, so this should be 4 to 14,
Yes,
and then 15 and over.
yep,
Could we change the temporary to seasonal instead?
Yeah.
And keep it at the 150?
yep. Keep that at 150. So that is the major changes to the food. Do you want me to continue to go to the other couple
Yeah,
that I
yeah.
have? So pools, spas, and beaches, again, I feel like those should be increased based on what other communities are. I know we don't really have many here, but if you do have pools, that can be a little bit of an extensive inspection. And you should have a pool plan review fee. Not that, I mean, if someone wants to build a pool, install a pool, that's not residential, right? That's commercial. It's public or semi-public. That would have to go through us for review. So if that were to ever happen, we would want to have a fee in place.
So
if
this
we're
would be
gonna
a
have
commercial pool.
Commercial pool. So if it's a hotel or
Yeah.
at a condo place or apartment complex, something like that.
Yeah.
And again, the haulers and the funeral directors, increase those again to match more our neighboring communities. And then the body art practitioner, again, I bumped that up. I was looking to bump that up to again match more of our communities. And when I'm looking to redo the regulations, one of the things I was looking to do is an annual, because we want to know who's in the
Oh, yeah.
in the business every year rather than every other year. That's, but that I'll propose when we do look at the actual regulation.
So are there other things here that we don't do annually?
No,
It's just body art that we were doing every 2 years?
but it's just the body art practitioner. The establishment is
Okay.
every year. The practitioner is every other year.
Okay.
But that we would put, that's a separate, that would have to go into the regulations. But I would be looking to increase the fee as well. Again, these are just based on some of the research I've done compared to other communities. So the board can choose to vote on everyone or each individually or wait. And I'm happy to answer any questions on it.
Do we have to have a public forum to increase fees just for regs, right?
Just for regulations. And I
Even
don't know if
though
it's
even-
all regulations. I think
I know Title V.
it's only Title V. I'd have to double check, but I believe it's only Title V. The fees, you would have to vote, and then we would post the updated fee schedule in the paper.
Okay.
Yep.
These look good to me. I mean, the
Yeah.
back page, I'm good with all of those. And then on the front, I think just the plan review of the food establishments we could talk about.
So changing that to new for new ownership, new business, and then if they're doing some renovations, then having that be the lower fee.
Well, yeah, I mean, I don't want to like disincentivize anybody from renovating their food establishment with the high fee, so I think it's nice to have the two.
Yep.
And then I would say that I just defer to you on what, if it's all the same equipment. I know what Dave was saying about filling out the application and things like that, but if it's all the same equipment and it's just changing hands.
Have to do the full review
I think
anyway.
Rika knows whether that's a full review or not, but I think it's nice having the two, whichever way we go. And then what do you think about changing the temporary underneath the, inspection for caterers to seasonal?
Yeah?
The temporary over 15 days
Mhm.
to seasonal, yeah.
Okay. And keep it at the
I think that
150?
makes sense, yeah.
Okay.
I
The
agree.
only other one that I'm looking at that is the retail food less than 500 square feet.
Yep.
I'm just wondering, just to keep it in line, I'm just wondering if we wanna go up to 100. I hate to bump it up that much, that's why I'm like, but I wanna talk it
That's why I
out.
didn't bump, cause it is, that's, it's
Cause
pretty
that's a big, that's a
significant.
huge bump, but,
But so this also brings into discussion, the establishments that, a lot of them that were paying the 35, those are like your Home Depots, the Gypsy Rose, right? Which they really probably won't be continuing a food permit unless the board puts a regulation in place that
okay.
requires them to have a food permit because they're only selling, prepackaged,
Packaged
non-TCS
foods,
foods.
yeah.
We talked about that last time,
Yeah.
right?
Um,
Okay.
And then that also, so then we have the Enchanted Loft, which also is only prepackaged foods. They do have some coffee. So the board, you need to decide there. I've reached out to the state. It's up to the board which way. If it's only coffee, right, you can choose to permit them for that, or you can choose not to. The only thing with the Enchanted Loft and businesses like that that I would want to keep on the radar is they're selling, just to make sure that the product that they're selling is coming from an approved source, right? That the prepackaged product is being made by a licensed establishment.
that's gonna get tricky.
I think she's the only, so far the only business that I know of in town that kind of falls in that, because they sell
Right,
food from small mom and pop shops.
right.
It's tough though, because technically it still falls under that
Yeah, I was gonna
exempt
say,
definition.
what about muffins wrapped in cellophane, you know, if somebody's making them in there?
So if it's made somewhere else and it's properly labeled and comes from an approved source, it's a non-TCS food. I mean, you can go to I don't know, it's Cumberland Farms, they have refrigerated product, but,
So doesn't that fall underneath, like the home bakers?
because they're not making the product there. Unless if they're making
If they
the
are, but they
product.
could be,
Yes.
right? So
Yep.
if I'm making my home products and then I wrap them up and I'm bringing them there to sell,
You would need to be permitted.
I would need to be permitted.
Yep, you would need double permit. You would need to be permitted by your local board of health, because you where you're making the product, and then you'd also need to be permitted by the state for a wholesale license. And the state does permit residential kitchens.
But then
wholesale.
Home Depot wouldn't need a permit to put it on the shelf.
Correct.
Okay.
Okay.
Well, some of that falls onto the consumer too, to read the label and where it comes
Agreed.
from, and
Agreed.
we can't track all of that.
I
It's
know.
impossible.
I know. And that's
It's
what
a good
just-
point, though.
Right, that's what I'm thinking, because we've had conversations before about residential kitchens. And, you know, those home bakers who sell out of their own
Yeah.
house. And I mean, I don't think we've ever had somebody apply here.
So currently you don't have
In
any
town for one.
regulations that prohibit it. So technically you could have, but it's limited, right? You can't make tacos out of your home, right?
Right.
You can only really make baked goods, jams, jellies, nothing that requires a specialized process, and the final product has to be shelf stable. I mean, even if you're making your own buttercream, that buttercream has to be lab tested to show it's a non-TCS food, that it doesn't require refrigeration, because butter is technically a TCS food, technically requires refrigeration. Most buttercreams with all the sugar, like they end up being non-TCS, but it still does require lab.
Right.
So residential kitchens are very limited in what they can do.
Okay.
That having been said, I'm okay with bumping it to $100.
Yeah, no, yeah.
Okay.
Put us in line with other communities.
The retail food, less than 50, 500, yeah.
500.
Because then it just makes more sense. You got 100, 150, 200. It just kind of continues to bump up from there. So, okay. All right. Any other? What did we decide on for nonprofit? Were we keeping it at 100 or?
I'll keep it, yeah, I have no problem with that, unless you want it different.
I'm just wondering if we want to decrease it for nonprofit. I mean, if you look at other towns, we've got 0, 0, and 25, and we're at 100. I'm just thinking maybe we wanna just decrease that to 25, and then if there's still waivers, we can still do that. What do you think?
It's fine with me.
Yeah?
Oh, the nonprofits
Yeah.
could waive too, just like the churches?
So like, yeah, I think let's drop that nonprofit to 25. And then if there are waivers that we need to put in place, we'll do that on a case-by-case basis. I just feel like we're increasing, but maybe for them, we need to decrease. If we're actually looking at what other towns are doing, we're actually way high on that.
So this is churches with kitchens.
It could be any other nonprofit. It doesn't have to just be
Yeah,
churches, but yeah.
well, we have a line there that says
For churches, yeah.
churches.
Yeah, we have another one there for churches. Okay. Any other thoughts or questions here?
No, do we have to, vote or?
Yeah.
Yeah.
Do we have to vote on each one, or can we vote with the changes
You can
as
vote with
discussed?
with the changes as discussed.
The only other, sorry, the only other question is the recreational overnight camps, is that enough? There's nothing to compare it to, but I just feel like,
Most communities keep camps one fee. That's why there's nothing there, because most of them, it's recreational camp across the board.
okay,
Oh, we have day camps
We have
separated.
Day
in
camps
there.
versus overnight camps.
And the reason I'm assuming you did that is because you have one
Correct.
overnight camp that's quite extensive.
and that's what I'm wondering, is 200 enough? Because I feel like there are many hours that are put into place in that plan review and the application review, that I'm not sure if we're making our money back on that plan review.
You probably are not.
Yeah, just, yeah,
But that being said, specialized day camps, if you had a specialized day camp, you probably, with the 100, you probably wouldn't either. And then you have to think about other recreational overnight camps. I mean, camps are extensive.
Right.
Either way, they're an extensive review process. But the one that we have in particular, because there's a lot of medical pieces that get reviewed, it's more extensive than you might have like like an overnight soccer camp, right?
Okay.
So you could definitely, like you said, you could definitely raise it slightly to meet a little bit more the time that gets put into the review and the actual inspection time, because that has been done by our public health nurse, contracted public health nurse in the past. But it's also in line kind of with what other communities
it
are
is.
doing.
Okay,
I mean, because like you can see under day camps, you can see the line for other communities, and that's generally camps.
so
Like-
that would be general camps.
Because
other than the
most,
separation. Okay.
I shouldn't say, from my experience in the two other communities that I've been in, the majority of recreational summer camps are day camps. You'll maybe get a handful of overnight ones, but it's usually day camps.
Okay,
I just think here we're unique that the one main camp we have happens to be overnight.
okay. All right. Okay, anything else?
Nope, not for me.
You wanna keep it?
I think so.
Okay.
We'll just keep it for now. All right. Okay, so I will entertain a motion to approve the revised, proposed fee schedule changes, as outlined and discussed.
Make the motion as stated.
I second it.
Any additional discussion?
No.
No.
Nope, with there being none, I'll call for the vote.
Yes.
Yes, approved. Okay. Thank you.
Sorry if I
Does it go from biannually to annually? Do we need to change the
That'll be in the
regulation?
regs, yep, and I'll work on getting that either, in March or April in front of the board.
Okay, so
I'll
we'll
aim
change
for
it to
March.
$100 now, and then it'll be Then it'll become annual when we do the
Exactly.
regulation.
Okay. All right. Next on our agenda, food establishment risk categories.
Yes, so I believe I had mentioned this at a prior board meeting, so I just wanted to have the board vote on it. So this is more in line with the FDA's goals and how inspections are conducted, right? That the food establishments that have the riskier or more complex processes and procedures get inspected more frequently. And so the FDA actually has different standards that they want you to meet, and this is part of one of the standards conducting food inspections. So you can see this first one kind of gives a background to why, and then the procedure behind it. And you can see on the back page it goes over category 1 would be inspected once a year, and then in that time between inspections we contact, make sure nothing has changed. Category 2 twice a year, category 3 3 times a year, category 4 4 times a year. And then the next two handouts kind of define those categories. So category 1 is going to be like your Dollar Tree, something like that, or like CVS, where they have refrigerated product, but it's all prepackaged. They're not actually doing any preparation. So that's the lowest risk category.
So it's coffee shops. Hot dog carts, coffee
Right,
shops.
coffee shops. I usually, depends on the coffee shop, because now they've gotten more complex. Like even your Cumberland Farms, right, they're starting to do more prep, so that kind of bumps them up a category. And then,
Do we know what the impact's gonna be on our inspection resources? If we start inspecting 4 times a year,
so it will increase, but I'm starting to do some food inspections as well. So I don't think we should see a cost impact at this time, because I'm going to be taking on some of the food inspections as well.
okay.
And then your category 2s are more, like that third page kind of breaks it down, like your Subways, your 7-Eleven, your Dunkin' Donuts. They do minimal prep. And then your category 3s are going to be more your full service restaurants that cook, cool, reheat, and includes childcare serving meals. And then category 4 is those that are serving a highly susceptible population. So that is childcare, but not all childcares will fall in that, because not all childcares are cooking from raw, but some are just pretty much reheating serving, so that lowers their risk. The senior center, for instance, would be a category 4 because it serves a highly susceptible population. If you're doing a specialized process, like sushi, that would be a category 4 because it's a higher risk, and it's a specialized process, requires specialized approval.
Okay.
And the thinking is if you lack active managerial control, so you have a lot of critical violations in your inspections, you don't have processes in place to monitor and correct any violations or any errors that occur, you can always be bumped up a risk category. So if you continue to have poor inspections, we'll be there more frequently.
Okay.
And then if it continues, obviously, the next step would be going from the board.
Okay. So basically, we would need to take a look at this to see which category each of our establishments in town fit into.
And I've started to go through
Okay.
them. Some are, like I said, you have your Dunkin' Donuts, those fall under one. Grocery stores, depending, those would, Market Basket and Walmart now, they do so much extensive preparing now in the grocery store, so those might actually be a category 3.
Sushi preparation.
Yep, so that would be, your sushi, that type of establishment would be a category 4.
Grocery stores though.
Yep, so
Yeah.
they're, but
Oh,
they're
they're
actually
They have their
permitted
separate,
separately.
right? Don't
have
they
a
have a
separate
separate
permit,
I think
yeah.
they have a separate
They
permit.
do.
Yeah.
Yep.
Yeah, I remember seeing a permit for them before.
Yep.
So what is our process now is to do like a one size fits all
It's been twice a year. Yep.
twice a year for every
Mhm.
category? Oh,
I think that's been the goal. I think most establishments have been twice a year. I don't know how accurate that we have been, but I have a spreadsheet with all of our establishments and I'm gonna start assigning myself and Steve, monthly inspections.
Yeah, I mean, we definitely have to think about, we have to think about our resources, but it shouldn't, affect what the, frequency of inspection that the category warrants. I didn't even think that I didn't even know this existed, but it makes sense if you're having, a lot of preparation or people who are at risk. It makes sense to be inspected more often.
And my eventual goal is so that the FDA has a lot of grant funding each year available to work on your food program. And so my goal is it's usually October time to apply for some of that and to work on different aspects. This is obviously one part, so when I do our food assessment, and I'm applying for the grant funding, I can say what we've already worked on.
Okay.
So this is not a regulation, it's policy? Or-
Correct, yep,
Okay.
And it's really just identifying our change to inspections.
right.
Okay. And, I mean, right now, every place is trying to do twice a year. So there's probably gonna be a good handful of places that are under category 1 that we're gonna have to reduce it, so some of it might balance out.
That's true.
That's what I'm kinda hoping. I mean, I'm trying to think of all the places in town that would be category 1.
I found it generally does increase it a little bit.
Yeah.
But
Oh, yeah.
not too significantly. And the idea is also, I mean, it's tough when you have a contracted food inspector, but like I said, I'm gonna be taking on some of the inspections as well, but if you're out there more frequently, your inspection should be quicker,
Exactly,
right?
yeah.
Because they know what to expect, they should be, it also
Right.
helps them in keeping on top of everything.
Mhm.
May take a while to get there, but the idea is that over time, the
Right.
inspections
We're
would
sure
be
the
shorter.
frequency isn't in our regulation?
I would say that it would be every 6 months. That's usually, that's been the standard. Do we have,
I don't even
I don't think we
know.
have
We don't
specific
have
food
one,
reg.
no, we don't, we
So
follow
I was gonna
whatever
say
the.
It would be the merged food
Yep.
code.
Yeah, we follow
Okay.
whatever the state or fed, whatever the guidelines are, yeah.
Okay.
Yeah.
Yeah, I was gonna say, I don't ever remember reading those. So,
Just wanna make sure.
all right, any other questions at all? Comments for Rika?
No?
No, I think this is great. Personally, I think putting them in specific categories, it just makes sense, right? So,
Risk management, right?
Absolutely.
Where the risk is higher, you spend more
Yep.
time.
how long has this been around for, just out of curiosity?
When I was in Marlboro, we began implementing it there, and so I would probably say 2017, but I mean,
Okay.
this is coming from the 2013 food code.
Okay.
But, so 2013, but Massachusetts officially adopted it end of 2018.
Okay.
But some communities in Mass had started switching earlier.
Okay. All right. So it's not like, 10 years old
No,
and we didn't
no.
know about it. Okay. It doesn't make me feel so bad. All right. Good. Any other questions? No, I'm good about this. You guys good? Are you good to vote, or do you want
Yeah.
to take time to review?
No, I'm good to vote.
All right. Okay, so I will entertain a motion to approve the risk assessment categories and inspection frequency document as outlined by our public health director by category in terms of frequency of inspections. I think as written.
I'll make the motion as stated.
I second it.
Any other discussion?
No.
No.
Nope, but there being none, I'll call for the vote.
Yes.
Yes.
Yes, approved. Thank you very much for putting that together. All right, next on our agenda, food establishment plan review.
So this doesn't necessarily require a vote.
Okay.
I just wanted you to see it, and if you have any comments or feedback. I know it's a hefty document.
It is
we
pretty
don't-
heavy.
We don't have a plan review document right now. So any new establishment, and currently the fees on top are the older fees. Those
Okay.
will be adjusted based off our vote tonight. But currently we have a fee for a pre-operational inspection and a plan review, but I don't think we actually have an application. I haven't seen one. And obviously, for certain establishments, not everything will apply to them, right? But this is looking at to capture everything, regardless of what kind of establishment you are. And it has everything in it that you need from a new business. I believe, so I want to say, I took this from another community. I've taken it a few times from the same community, but it comes from the Conference on Food Protection. They have a couple of sample standard documents that they release, and this is kind of one of them that's been tweaked to fit Massachusetts needs. And my goal is to begin implementing it for any new establishments. So they would complete this in addition to the food permit application.
Okay, that was my next question,
Yep.
okay.
So they complete both. A lot of the material is the same. This is just more extensive.
Yeah, I was gonna say, some of it looks very familiar to the permit application. Is there, I guess once this is situated, is there a way this can go in electronically?
Well, yeah, that will be.
That will be
plan.
the ultimate plan in the end,
Yeah.
okay, just throwing that out there.
No, definitely.
Okay.
I want to get it online.
This is great. So this asks not only for like some plan, like copies of plans and things like that and certifications, but then also contact information and special certifications.
Yep, and how they're going to prepare food, if they have enough storage space, what their finished material is, right, so that we know it's easily cleanable, smooth, non-absorbent, safe for a food establishment. So it really covers everything. It has the plumbing piece, so you know that you're not going to have any backflow, that they have proper backflow prevention. And like I said, this doesn't apply, like your smaller establishments, some of this might not apply. If you're going to be a new retail store, it might not apply, but a fair amount does, so you can always write not applicable for those that it doesn't apply to.
Mm-hmm. This might cover a lot on the food permit application, so maybe we could just say, have you completed this, whatever we're gonna call this document? And
Yeah,
link it somehow.
Is this an
Somehow, there
annual
might be a
review,
way.
or is this a one-time review?
A one-time review.
it's for new establishments, right?
Yeah, and I
Okay.
saw a typo on the first page. Oh. Single letter. Or change of ownership.
Or change of, yeah, okay. Yeah, that might, I think if we can eventually, once it gets in there, there's a lot of this stuff that does cross over. So we might be able to link some, I don't know, we have to figure that out electronically.
What's an IPM plan?
Integrated pest management. Spell that out.
Yeah. I had to look up TCS and ROP.
This is really extensive, actually.
I just think it makes for more thorough review.
Mm-hmm.
Absolutely. We don't miss anything.
Some of these questions toward the end seem like they should, the establishment should be answering yes, but if they answer no, something like you'll have to circle back on,
Yes,
or,
because
yeah.
sometimes, you'll be surprised, sometimes people say no, and I'm like,
Wrong
wrong
answer.
answer.
Yep, try again.
So what's the plan?
Yeah, okay.
And obviously, like, a lot of those, it's those yes, nos, like, it's easy to say yes, but it gets them thinking of what they need to have, and when I do a pre-operational, it's things I'll be reviewing either way.
So you're gonna see it, yeah.
Yeah.
Yeah, no. I think it looks good. Very, very in-depth.
So like I said, a vote's not necessarily needed, but I just want you
Okay.
to see what, like, I'm
Yep.
planning to
Perfect.
implement, as long as you're comfortable with it.
Yeah, it looks great.
Looks good to me.
Yep, looks fabulous. All right. Next on our agenda is our Board of Health meeting times.
So this is just something I wanted to suggest. Vote doesn't have to be taken tonight, decision doesn't have to be made tonight, but Wednesday is now Oxford's late night. And so I was wondering if down the road, we would, you would be open to potentially moving the Board of Health meeting to a Wednesday evening. If we do move it to a Wednesday evening, it might not be able to happen here. We might have to use a different space, because sometimes FinCom does meet on Wednesdays, particularly during budget season. So like I said, it doesn't have to happen next meeting, because I know sometimes with your schedules, you've already made it, so Monday nights work. If it's even something in a year we want to review again, but I just wanted to bring it to the board for discussion or to think about.
Okay.
I'm okay with moving it to Wednesdays.
I'm okay. I think it's just Dina. Because
Yeah,
I
it
know
doesn't-
you usually plan your
I take it
schedule
off,
ahead
yeah.
with the Mondays.
Yeah, but I could start in April.
Could start in April.
Yeah, my schedule's done through,
Yeah, I was gonna say, I
March.
know that your schedule's kind of,
but I could start in April.
do you want to start with the first meeting in April, or do you want to start in May? Well, I don't know, what's the date of your schedule through?
Oh, the first, so.
Okay.
Yeah. So April's fine. The 6th would be that first Wednesday.
Okay. What do you think? Where's my, so I'll look it up. I'm sure I'm fine. Don't work until 11 PM and the meetings should be done by then, so.
That doesn't mean you have to get up earlier, potentially, to
Yeah,
lose some
I'm
sleeping
fine for
time.
It's
April
all right.
6th. Yeah.
Yeah, I think we're good to move starting in April.
Yep.
Okay.
To Wednesdays at 6?
Mm-hmm.
Okay.
Sounds good.
And you're okay if it it doesn't end up here, I'd have to
Mhm.
figure out where that meeting's supposed to be? Okay.
Yeah, we've only been meeting here for a very short time.
Okay.
Yeah.
We used to meet in
So I
the
think
back room.
we would have what? We've got options of the senior center.
Senior center might be an option, library.
Library.
Potentially, I don't know about the sound, but potentially back there, that's something I
That's
have
where we used
check.
to meet.
Right.
Yeah.
It wasn't too bad.
No, it
If they
wasn't
had
that
started
bad.
a meeting like, oh, but they were at 5 o'clock. And I
Right.
think these meetings started at like 6 or 7.
Yep. Yeah, so we were almost done usually by the
Yeah.
time the next meeting started, if
So
we
we'd-
were at 5.
We'd hear them kind of shuffling in and.
Is the library open late on Wednesdays?
I believe the library was a potential option.
Okay.
I would have to check that.
Okay.
Um,
All right, do we have to vote on changing the meeting time?
I actually.
I don't think so. We post each meeting.
right,
Yeah, so I
as
think
long
we're
as
okay.
Okay, but
Okay.
it's-
All right, that works.
Sounds good.
What a change. I've had them on the first Monday of
I
every month since I've been
I'm gonna
on
show
the
up, for
board.
sure.
I'm gonna have to go into my calendar and like adjust it
Really
as soon as I
change
get
it.
home, because I will just like,
That's funny.
yeah, just
I'll try to remind you.
I'll be like, oh, I'll gotta show up here on a Monday night.
We'll get emails out, so if you don't get an email
Just
from us,
random,
then
you
don't
know?
show up.
Okay. All right, perfect. Sounds good. All right, and last on the agenda are permit reviews and correspondence.
So here's the permit reviews, and was there correspondence in the email?
I don't like to be
That was
first.
sent?
I don't like to be first.
I'll start with Dave.
I start with you.
Let's start with Dave and it can go down.
I signed on the wrong line, like, I can't.
Tina, I love it. I don't want to be first.
I love it that you're brave enough to say it out loud.
I know. So was there any correspondence we?
We'll get it to you next meeting. It was just an update letter.
Okay.
It was just, I know that, in previous committees, when we receive letters from other departments, it's usually addressed Board of Health. I like to include it so
Okay.
you can read it. It's not on the agenda, I did wanna, bring something else up that I forgot to bring up in my director's report. With, food establishments that do not have the proper sinks, such as hand sinks, is the board comfortable with me guiding them? Like, we have one establishment that has a 2-bay sink and a dish machine, no hand sink, and they're looking to use one of the bays of the 2-bay sink as their hand sink. Everything goes to the dish machine. The other bay would just be a pre-soak for those dishes that need a little
For
extra.
employees, this isn't for customers also, or?
Correct, it's just in the kitchen for employees.
But I think I read, you said that they're supposed to have, this particular establishment is supposed to have a 3-bay sink,
So generally,
2, and they're supposed to have a hand washing sink. in
So
addition.
generally, a kitchen should have a 3-bay sink, and then they can choose to have a dish machine. The code does give allowance to allow for a dish machine, instead of a 3-bay. 2-bay, technically, if you only have a 2-bay, needs Board of Health approval to upgrade, or to, not to upgrade, but to, use a 2-bay instead of a 3-bay. Generally, I prefer an establishment of a 3-bay. If they want to have a dish machine in addition, great, but I still like to have that 3-bay as backup, and then I'd like to see a hand sink. But I also realize that some older businesses, it's just, plumbing-wise, it can be difficult, especially if you don't have a basement, because then to run the plumbing, you're really, you have to pull up the floor, right? You're jackhammering
Is that
up
the
the floor.
situation with the,
They don't have a basement,
okay,
yeah.
okay.
I know we have 2 establishments. One is gonna be meeting with a plumber this week, to be looking at where a hand sink can go, because in their case, they actually use their 2-bay to wash dishes in addition to their dish machine, because not all their dishes can fit through their dish machine.
Okay. Just while I'm looking at this one, it just brought something up to me. So when looking at the permits here, there's a couple, of like allergen and stuff, they expire in like April, May. Do we have a process in place to make sure that we get an updated one?
We don't have a process in place right now. I would say it's usually during the inspection
Okay.
process, because I know both Steve and myself check that when we go out.
Okay.
And for food establishments, we'll be renewing soon,
Okay.
and so we'll be getting updated ones at that point too.
Okay.
If it's a routine, I mean, not a regular permit, not like a temporary or something like that.
Is this the smoke shop that we met with?
Is that Days?
Yeah,
Yes.
okay.
Yep.
Good.
So they're still gonna be, we're not actually gonna be issuing the permit to them quite yet.
Yeah.
Cause I still wanna do a pre-operational, they still need to get their occupancy,
Mhm.
but we've been in communication with them.
Okay. Must be tobacco permit time.
They're a little late, but we're getting them.
That's okay.
And the quarterly town newsletter that the town manager's office puts out was just released, and in there, we do note that our applications are now electronic, and when it's time for a food permit renewal, they'll be putting the notice up on the town board.
Good.
Great. Are these all tobacco permits? All right, I guess not.
So I don't think so.
The last one. Has anybody giving you any trouble about providing customer lists?
Providing what?
Customer lists for the transporters, Opal?
No, no.
Have we received, or have we started to receive the disposal slips?
Like the weight?
Yeah.
Yeah, Shane reached out and everybody responded.
Perfect.
So I have it on my calendar to reach out quarterly to get those from them.
Good.
Okay, great, perfect.
You must have the magic touch.
You get this place running like a top, that's great.
Yeah.
Or we're just coming in at a good time, they've all adjusted already.
Could be, yep.
It doesn't hurt that there's 2 people now.
They have other regulations that they can protest. This one doesn't seem to have a customer list.
If they don't have it attached, does that mean it was electronic? Yeah, that's why. I'm kind of seeing that, the ones that are lighter, you can tell they did like,
Everything on-
yeah, they did it all online, which is kind of nice. How is the online working for you, Shane?
Very well. There's
Good.
the occasional glitch, but then
Okay.
Denny fixes it right away.
Good, good, okay, perfect. address on that one? 196 Leicester Street? Okay. This is true. So this one here for the donation bid on 720 Main Street. So this has the old business name here.
Okay.
So who are they getting permission from now to use that property? Because it's not Rossi's Dry Cleaning, because they're closed.
There should be a letter attached from whoever owns the property now.
So this is receipt of donations and regulations. There's the drawing that says Rossi's. This is acknowledgement of the regulations. Property owner Arthur Rossi.
May still be the owner.
He might still be the property owner.
What's the date on the letter, on that,
12/10/21. Well, I know the business was closed.
Yeah, maybe it's.
I don't think it was in our notice of sales for December or January.
This was a while ago. This was like last year.
do we require a
But I mean, the
document?
property being sold.
Okay.
Yeah, they may have just closed the business.
So maybe they closed the business but kept the property.
Is it in that park, like in the parking lot of it?
It's right next to the buildings. So you can't see it if you're going towards Walmart, but coming back from Walmart, you can see them, yeah. I look at donation bins a lot when I'm driving. Is that bad?
Not if you're on the board of health.
No. I tend to know where a lot of them are. All right. That's all, and that was a stack.
That was a
You shouldn't
stack.
expect this many again until
Good.
probably June or July.
Yeah. Perfect. All right.
Okay.
Anything else that you have?
Nothing else. The next meeting is March 7th.
March 7th. And then we'll switch to Wednesdays. One more Monday.
Yep.
I'm gonna show up. All right. I will entertain a motion to adjourn the Board of Health meeting at 7:40 PM.
Make the motion as stated.
I second it.
Any discussion?
No.
Nope. I'll call for the vote.
Yes.
Yes.
Yes, meeting adjourned.
Great. Thank you.
Thank you, everyone.
March